child care program. I've worked here since 1987, so that's looking at 28 years. With the initiative, I was able to use some of my night shifts to enhance my practice a little bit. I was able to do a bit of research, which was kind of enjoyable, and actually help as far as the journey towards getting our baby-friendly initiative. I really learned a lot, and I'm really part of the baby-friendly initiative now. I'm more on board now because I've sort of worked on the research, and I totally get where it's all coming from and why this designation will be a plus for Joseph Brant.
Hi, I'm Maryann. I'm a registered nurse at Joseph Brant. I've been here for 20 years, and prior to that worked in outpatient care just as a new grad.
Courtney and I'm a registered nurse at Joseph Brant Hospital. I just started in February and part of the new grad initiative. I'm on the maternal child unit, and it's very exciting. It's a great start for my nursing career, and I'm loving it right now, and I have so many benefits of the program, so I'm really happy with it.
Yeah, when Angela had approached me about the program, I was really excited. As a lactation consultant and as a MACU nurse, it really allowed me to use some skill sets that I had learned from before to work toward what we are now sort of endeavoring to do, is become BFI certified in our program, and that just means that we're trying to get as many moms breastfeeding as possible and to support them in their choices. With the lactation experience that I had, I found that it was really helpful because it allowed me to sort of venture off into more research, into more sort of statistics that we don't normally sort of get involved in when we're nursing on the unit, but just a lot of really good education, updating in terms of what other hospitals are doing, how we can work together to support this endeavor with BFI, and I just felt for myself personally I really grew in just learning more outside the box in terms of not just hands-on care with the mothers, but sort of knowing what's going on sort of out in the community and how we can all work together with public health and other departments to really advance and to get this program underway. And I just felt it was really exciting and really helpful for me personally.
So as part of the new grad initiative, it's like a 6 months program where I'm paired up with a mentor. And fresh out of nursing school, I feel like that's probably the best way to be starting off, because you have that person there with you for those 6 months, and you can rely on them and ask questions and really guide you in your practice, because my practice right now is just in the beginning. And also just like the team on the maternal child unit at Joseph Brant Hospital has been extraordinary. Everyone is always willing to help and lend a hand, or I can ask a question to them, and I've just found that whole team camaraderie around me has been wonderful, and I can't say anything negative about anything. I love this hospital. I feel like the new grad initiative has really set me up to be successful in my career.
So my name's Erin. I graduated from McMaster in their BSCM program last May 2014, and then I applied to Joseph Brant and got into the new grad program, which started at the end of July in 2014. So the initiative was very helpful because I'm working in labor and delivery, which is an area of nursing I hadn't even experienced before. So I had 6 full months with full-time hours in the new grad program, paired up with a nurse who taught me and guided me the whole way along, which I think I wouldn't have thrived if I had just been hired as a part-time nurse with no experience. So it was very helpful.
And I think it's just that camaraderie and the fact that we're all really working for one purpose. I think it's for the benefit of the patient and in our case mothers and babies, and I just think everybody works so well together, and it's just a wonderful supportive network. And I think when you go to work and you have that, that just makes coming to your job every day really a pleasant place to be.
You definitely would want to work at Joseph Brant Hospital. It's the most supportive environment, and your colleagues will be wonderful people.